Good afternoon. My name is Moronkeji Kolawole. This afternoon, I'll be presenting my case study on failure to thrive in adults. My patient name is Jane Doe, 55 years old, female, with diagnosis of failure to thrive in adults, severe protein calorie malnutrition. Past medical history include diabetes mellitus, hypertension, GERD, and dysphagia. Signs and symptoms include decrease in food intake for 3 months, abdominal pain, cough, loss of weight, denies nausea, vomiting, diarrhea, and constipation. MD diet order, MPO, secondary to abdominal pain, and per SLP note which states patient failed dysphagia screening. Patient was on medication, Sofran, Lispro, Pepsid, Metformin, and Lisinopril. Upon my assessment, patient was alert and oriented times 3. Weight was 110. Usual body weight 140 pounds per patient. Ideal body weight calculated to be 130. BMI calculated to be 70.80. Malnutrition examination parameters. Energy intake is decreased by 50% for 3 months with difficult swallowing. Weight loss of 21% in 3 months. Severe body fat loss, severe muscle loss, which put this patient in severe protein calorie malnutrition. These are the labs. The creatinine is high, sodium is low, glucose is high, hemoglobin is low. All other lab values are normal. My initial PES statement, which is my diagnosis, is unintended weight loss related to decreased appetite, decreased food intake, as evidenced by visible muscle and fat wasting, and 21% weight loss in 3 months. I estimated energy need using predictive equation. The total energy need was 1750 to 2000 kcal, which I used 35 to 40 kcal per kilogram body weight of 50 kg, secondary to malnutrition and hospital protocol. Protein need between 75 to 100 grams due to malnutrition and per hospital protocol. Fluid need, I use 1 ml per kcal, which is 1750 to 2000 ml. The tube feeding ordered by MD was diabetic source at 20 ml per hour using continuous nasoduodenal tube. The reason they use nasoduodenal tube was because of the patient is at risk of pulmonary aspiration, and the patient is they believe the patient will be off the tube feeding by 3 weeks. So that's why they do continuous and nasoduodenal tube. The feeding that they had the patient on provide 576 kcal, 29 grams of protein with 393 ml of fluid. This particular feeding meets 31% of kcal and protein and 21% of fluid need. The DRI meets 48%. Diabetes source was used due to past medical history of diabetes mellitus with current blood glucose at 245 mg per deciliter. My P estimate for this feeding is inadequate energy intake related to tube feeding infusion rate, as evidenced by EN meeting 31% kcal, 31% protein, and 21% fluid need. My intervention was to recommend to increase diabetes source 1.2 starting at 20 ml per hour to increment of 10 ml every 4 hours to goal rate of 65 ml per hour for 24 hours. This will provide the patient with 1872 kcal, 94 grams of protein, and 1273 ml of water. This particular feeding meets 100% estimated kcal, 100% estimated protein need. The DRI meets 156%. Then I recommend additional water flushes of 100 ml of water every 6 hours to provide additional 600 ml of water. Adding it together, it will provide the patient 1873 ml water to meet 100% fluid need. I also recommend to monitor blood glucose and to adjust insulin for optimal glycemic control. My goals for the patient is for the patient to tolerate tube feeding, to promote glucose control, and to preserve lean body mass. For these patients, I will be monitoring and evaluating total energy intake, protein intake, fluid. I will monitor weight changes and BMI, the labs, and the bowel regularity. By the 8th day, patient was tolerated tube feeding. There is a little increase in weight change to be 115, and the BMI is 18.6. As we can see, the creatinine is still high, but it's trending down. The glucose is still high, but it's trending down too. The hemoglobin is still low, but is trending up. By day 14, patient was still tolerating the tube feeding. A consult was sent to the speech language pathologist for swallowing function, which should recommend puree diet, advanced to mechanical soft, and to regular consistency as tolerated. By day 16, a calorie count was ordered. Day 1, 30% of the food were tolerated by the patient. By second day, 50 to 75%. By third day, 75% of food were tolerated by the patient. So at this point, patient was weaned off tube feeding while she's allowed to take oral food. By day 20, the patient was discharged with a weight of 125 pounds and BMI of 20.23. All labs were normal. Patient was discharged home with 1800 kcal carbohydrate restricted diet and boost glucose control 2 times daily. And any possible readmission in the next 30 days? No. Thank you.